As we discussed in the previous video, hypothesis testing helps to determine if results are statistically significant or occur by chance. But because hypothesis testing is based on probability, there is always a chance of wrong conclusion about the null hypothesis. There are two types of errors, type 1 error and type 2 error. Type 1 error occurs when you reject the null hypothesis when it's actually true. In other words, you conclude that your result is statistically significant when in fact it occurred by chance. In type 2 error occur when you fail to reject the null hypothesis when it actually falls. In other words, you conclude that result is occurred by chance when in fact it didn't. Let's understand the error with the help of an example. Suppose you have to do a clinical trial of a new medicine. You took a random sample of 200 patients and results shows typically patients recover without medicine in 7 days and with medicines they recover in 5 days. In this case, null hypothesis is there is no effect on medicines. An alternative hypothesis would be the medicine has an effect. So, if the null hypothesis is true, it means that there is no effect of medicines and you incorrectly concluded that medicines relieve the patient when it actually ineffective. You are making type 1 error. The probability of making type 1 error is represented by alpha and alpha or significance level. Alpha is typically set at 5%, and 5% means there is a 5% chance you are wrong when you reject the null hypothesis. You can reduce the risk of type 1 error by reducing the significance level from 5% to 1%. But reducing the risk of type 1 error means you are more likely making type 2 error or false negative. As per our example, you are trying to conclude that medicine is ineffective when it is actually effective. The probability of making type 2 error is beta, and beta is related to power of hypothesis test. Power is equals to 1 minus beta. Power refers to likelihood that a test can correctly detect a real effect when there is no one. You can reduce the risk of making type 2 error by ensuring your test has enough power, usually around 80%. Thanks.